Recently, I had a coaching call with a client who had just had a custom MARPE placed by a top orthodontist on the East Coast, and this guy was miserable. So miserable, in fact, that he wanted to abort treatment completely. Why? Well, MARPEs are big and bulky, and this particular MARPE had arms that went off the appliance onto the teeth. It was a Partners Dental Studio custom MARPE, a big sprawling metal contraption. He could not enjoy food anymore because it was getting trapped. He could barely speak without sounding like he had a speech impediment, basically. And he had all this anxiety as well about whether or not he would even get the split. And if he did get the split, would it be symmetric? Or would it be asymmetric? Would it look good? Would it be ugly? And even if it was a perfect split, he would still be facing months of expansion, months more of discomfort, and then 18 to 24 months of orthodontics to piece it all back together after getting his expansion. MARPE is a very tiresome, uncomfortable, and costly process. Let's not forget, costs have gone up across the board. What used to cost $10 now costs between $15 and $30, depending on whether or not you're on the East Coast, West Coast, custom MARPE, FME, so on and so forth. So it's no surprise that many clients of mine wonder, can I leapfrog the MARPE and go right into the jaw surgery? Now, before I go too far comparing MARPE and jaw surgery and saying, screw MARPE, do jaw surgery instead, it's worth it to pause and just remember that jaw surgery is an incredibly scary, dangerous process. With jaw surgery, you can get permanent damage to your nerves, permanent damage to your temporomandibular joints. You can hate the way you look after. With MARPE, it's a very gradual process. It's 1/fraction of a millimeter at a time. If it's going asymmetric, or even if it's perfectly symmetric and you don't like the way it looks, guess what? Crank it back, turn it back. With jaw surgery, there is no such return policy. With jaw surgery, you go to sleep, you wake up, here's your new face. Good luck, buddy. And how do we mitigate? How do we mitigate the risks involved in jaw surgery? How do we avoid a botch? Well, the best way to avoid a botch with jaw surgery is to work with a top surgeon who's very experienced. And those providers tend to be out of network with most or all insurance companies, and so you are looking at a $40,000 to $100,000 out of pocket to mitigate the risk of having a bad outcome with jaw surgery. So between MARPE and jaw surgery, we're talking 15 to 30K versus 30 to 100K. It's an order of magnitude more risk in terms of something going catastrophically wrong, and it's incredibly much more expensive. So keep that in mind. Consider that a jaw surgery disclaimer. Now let's discuss the situations in which maybe you can skip a MARPE and do jaw surgery instead. Reason number one to skip MARPE and go right to jaw surgery, and this is far and away the most important reason on this whole list, is your nasal breathing fine? If your nasal breathing is great, if you have no trouble at all with stuffiness, then you can probably, given all the other considerations, skip MARPE. MARPE really excels when it comes to improving nasal breathing, and conversely, jaw surgery really lacks when it comes to predictably solving nasal breathing problems. Sometimes it does solve nasal breathing problems. Indeed, when you do a Lefort cut on the maxilla and you drop the maxilla, you rotate it, things do change with the anatomy of the nasal airway. You may heighten the nasal airway. You may even get a piriform rim osteotomy where they shave down the bone at the floor of the nose, and all of these things can contribute to improved nasal breathing. However, what we have seen play out over the last few years, what I have seen play out with clients over the last few years, is that those patients that were sold and told that jaw surgery would solve all their nasal breathing problems, many of them came out of jaw surgery sorely disappointed with the amount of improvement that they've gotten on their nasal breathing. And in fact, I can't tell you how often, at least once or twice a month, I am encountering patients, clients to me, not patients because I'm not a healthcare provider, clients of mine, coaching clients inside the joint who want to do MARPE after jaw surgery. And that is a terrible, terrible place to be. MARPE is already a risky proposition. It's already hard to predictably get a good clean split with MARPE, a nice symmetric expansion. Now factor in having had previous jaw surgery cuts, especially a segmental Lefort where your palate gets pizza sliced into multiple different pieces, and then hoping that the split in the fractures that occur with MARPE occur exactly where you want them to, right on the midline and symmetrically left-right. Not to mention the fact that if there's a big contiguous plate that crosses your midline from the jaw surgery, such as a custom plate that often stretches one piece across both sides, that would have to be removed. All of these factors tremendously complicate the situation for those seeking MARPE after jaw surgery. So, if you are someone who presents with distinctly poor nasal breathing, then you are someone who is going to want to strongly consider doing MARPE before jaw surgery, even if you have some of the extenuating circumstances that we'll talk about in the next 4 points. Why does MARPE improve nasal breathing so much as compared to jaw surgery? Well, it's all about the mechanics and the anatomy of it. When you do a MARPE, and especially when you do a MARPE without Lefort cuts, without dome, or without the SARPE, the archaic SARPE modality that was popular up until a few years ago, when you do a MARPE with just a midline piezo cut, you get a triangular prism-like expansion. Let me demonstrate. That goes all the way up the midface, basically to the base of the eyes. You get expansion posterior, meaning deep into the nose, coming down the z-axis, down this way, and you get it superior, which means up the volume of the nose, so that really every dimension of your nasal cavity is being decompressed. Your turbinates are being decompressed. If you have a deviated septum, you're creating space around it so that if there is a pinch point, maybe it's not so symptomatic. Your eustachian tubes are being decompressed. Everything about the nasal breathing is improving volume-wise at a skeletal bony level with a MARPE. Whereas with a jaw surgery, you're not getting any change to the nasal cavity above the site of the Lefort cut. So if the Lefort cut is occurring right here, let's say right here, all change happening to the nose is occurring below that because the Lefort cut acts as a brake in terms of the activity and the action of the change that's occurring. No change can occur above the cuts. You don't get any zygomatic change, which can be aesthetic, of course. Nice angular cheekbones, especially on men, can look really good. But more importantly, the zygomas, when they change, that's really just an indication that expansion is happening everywhere all along the midface. And functionally, for nasal breathing, this is unparalleled, especially compared to jaw surgery. Conclusion to point number 1, if you're someone that has great nasal breathing, maybe you can skip MARPE. If you're someone that has poor nasal breathing, definitely don't skip MARPE. A second reason to skip MARPE and go right into jaw surgery would be if your side profile is your primary pain point. If you have arrived to jaw hacking because you don't like the way you look this way, because you think you have a weak jawline, your chin is too small or non-existent, buried in your neck, and you have an obtuse nasolabial angle, which means that the angle formed from the bottom of your nose to your upper lip is greater than 90 degrees, which indicates that your jaws are set back. And if that's primarily what you want to fix from a cosmetic point of view, then you can probably skip MARPE, because while MARPE does actually advance the palate, I mean, it's primarily a transverse expander. It goes left-right, it goes this way. But we know that also in roughly a 5-to-1 ratio, the MARPE will actually advance the palate. For every 5 millimeters you go left-right, you will advance roughly 1 millimeter. Still, that is a negligible anterior-posterior change compared to jaw surgery. With MARPE, you might get a maxillary advancement of up to 3 or 4 millimeters that would be an aggressive expansion, and maybe even supported with a protraction device, such as a face mask like an FMA. But compared to what jaw surgery can achieve in the AP, the anterior posterior, we're talking millimeters with MARPE versus centimeters with jaw surgery. And let's not forget that the MARPE acts unilaterally on the maxilla and leaves the mandible in the dust. If you do get bona fide skeletal advancement of the midface and maxilla with MARPE, the only change that you're getting in the mandible is a repositioning. It's not actually a growth. This myth that in adults, if you grow the maxilla, so to speak, that the mandible will follow, that is absolute hogwash. It doesn't work that way. Mandibles don't grow in adults. Okay, I'm sorry. It's sad that they don't. I wish they did. I wish that there was this magical kind of mechanism in the body where whatever we did to the maxilla, that the mandible would just genetically follow. As adults in our 20s, 30s, 40s, probably even in our late teens, maybe even in our early teens, it just doesn't happen that way. So you can't pull your midface with a MARPE and a face mask and just expect your ramus to lengthen. You can reposition your mandible and make it look like your mandible got bigger, but there's a limit in the temporomandibular joint as to how much reposturing of the mandible can occur before you have dislocated your temporomandibular joint in the anterior position. There might be 2 or 3 millimeters of play depending on the width and the height of the fossa of your temporomandibular joint, but it is absolutely limited indeed. Whereas with jaw surgery, of course, you can do 2 to 3 centimeters on the mandible if you need that much. Jaw surgery is the way to go when it comes to side profile correction. Reason number 3 that you might skip MARPE in favor of jaw surgery. That is if you have a tall face with a gummy smile. This is a condition known as vertical maxillary excess. Such faces often grow down and back, and that excess height of the face displays as a gummy smile. The reason that the smile is gummy is because there's extra bone right in this region where the bone shouldn't actually exist, but because there was an unhealthy growth pattern, there it is. And it's bursting through the gums, and it's very ugly. What does this have to do with MARPE? Well, MARPE actually heightens the face. It contributes, or I should say it can contribute to vertical maxillary excess. We just talked about how MARPE not only makes the face wider in the left-right, which is the obvious dimension that it operates in, but it can advance the face. Well, there's a third dimension that MARPE changes the face in, and that's in the vertical. It actually causes the midface to drop slightly. So if you're someone who already has too much drop in the midface, you don't want to add to that. Or at a minimum, you should be aware that it's going to happen. Don't do MARPE for cosmetic purposes, certainly if you're someone with vertical maxillary excess. Maybe if you're someone with poor nasal breathing and you have a little bit of vertical maxillary excess and you plan on doing jaw surgery anyway later, then sure, do a little bit of MARPE. You might want to manage it so that you don't make the gummy smile absolutely ridiculous. But it's true that the jaw surgery later will bail you out of the gummy smile if that's the position that you find yourself in. And of course, I should say, in wrapping with point number 3, while MARPE can exacerbate vertical maxillary excess and gummy smile, jaw surgery can correct it. Through an impaction and a counterclockwise rotation, you can just reposition the maxilla so that the tooth show is appropriate and that there's no excess gums that are showing. Reason number 4 to skip MARPE and go right into jaw surgery: you have a large pre-existing asymmetry. Now, we all know that MARPE can create asymmetry where none existed. We know that MARPE is basically a dumb appliance. It's a brute Newtonian expander that just goes left-right. It has no smart features. It has no built-in sensors to indicate to you that something is going wrong. If one side is expanding more than the other, the only way you'll know is if you have eyes on it or if your doctor has eyes on it and you catch it and you stop it. So needless to say, If there's already a pre-existing asymmetry, the chances that that will either not be fixed at all or that it will actually be magnified because that asymmetry, maybe it exists for a reason. Maybe there was already disproportionate amount of resistance on one side of your face as compared to the other. One side is more developed than the other. One side has higher bone density than the other, hence the asymmetric development in the first place. Well, what we have actually seen is that MARPEs tend to make asymmetries worse, not better. Now, some providers are experienced enough and skilled enough and bold enough to actually create and orient appliances customly built to try to counteract such asymmetries, but that is only the top tier of providers that will actually do that. Your run-of-the-mill MARPE providing orthodontist or general dentist who just took a weekend course and has under 20, 30, 40, 50 cases, they are not going to be orienting jack screws to try to counteract pre-existing asymmetries. More likely what's going to happen is that they might not even see that the asymmetry is there because they're so hyper-focused on just the hole in your face, your mouth, so to speak, that they might not even zoom out and do a CBCT analysis that captures the landmarks that indicate that there's a skeletal asymmetry in the first place. So basically what I'm saying is the asymmetry risk with MARPE is already very high. And when there's a pre-existing asymmetry, it just takes a situation that's already difficult and already risky and adds an extra layer of risk and difficulty to it that's probably not worth dealing with. So those with pre-existing asymmetries, unless you plan on doing jaw surgery after to bail you out of, let's say, a maxillary cant that gets exacerbated with the MARPE, just don't do the MARPE. Or if you have really severe nasal breathing problems and you're desperate to do the MARPE, take it easy on the MARPE, keep an eye on it, or go out of your way to seek only the best, most experienced MARPE provider that would be able to manage, mitigate, otherwise minimize the harm caused by the MARPE exacerbating that, or at least not making it any worse. Finally, the fifth reason to consider skipping MARPE and going right into jaw surgery is if you have small teeth and no dental crowding. In other words, if you have no arch length deficiency, if you have sufficient arch length to house all your teeth, maybe you can skip MARPE, all other things being equal. I call this the Dr. Gunson reason for skipping MARPE and going right into jaw surgery. MARPE creates arch length. Jaw surgery, when you expand during jaw surgery, there is no arch length that's created. So if you have small teeth and you create more arch length with MARPE, and you're creating that arch length by expanding at the midline, and literally a diastema forms here between your central incisors, and the amount that you expand is the amount of new arch length that's created. If you already have sufficient arch length to support your teeth and you create more, you could end up in a very unaesthetic situation where your teeth are too small for your arch. This is ugly. Yes, it can be managed through restorative dentistry by making your teeth bigger with onlays, veneers, but that is an added cost, and that is very much an added project here that a lot of people, this is a typical thing that occurs with MARPE. If you overdo MARPE or if you don't do MARPE in the right type of patient, auxiliary treatments become necessary. Maybe you expand too much and now you need SFOT. There's another 20 grand in an invasive surgery. Maybe you have someone with no arch length deficiency and you expand too much. Now they have teeth that are too small for their bone and it looks funny. Now they need to do 20, 30 grand in restorative dentistry. Maybe you expand someone into an asymmetry. Now the only way they can get rid of the asymmetry is with a jaw surgery. Well, now you're facing down the barrel of the gun of jaw surgery. Typical stuff. This is why MARPE has in some ways developed a bad rap as it's become ubiquitous among airway providers offering it. Just be careful. If you are doing MARPE for aesthetic reasons and you have no arch length deficiency, maybe you shouldn't do the MARPE. Be aware that this is a thing that happens. Sometimes you end up with teeth that are too small for the bone and it looks weird. If you need expansion for other purposes, maybe for, improving tongue space or maybe a modest nasal breathing problem, you may be better served with the segmental Le Fort, because the way the segmental Le Fort works, because the expansion, how should I show this? Let me show you. With the Le Fort, let me pull apart this skull. With MARPE, the expansion occurs like this. This is a very simplistic explanation, but with MARPE, the expansion occurs like this, okay? You're creating arch length at the front, like this. With Le Fort, the expansion tends to occur like this. So it's like it's a reverse conical expansion. All the expansion is occurring between the molars in the back, basically, and there's no diastema formed at the central incisors, so that the arch length is not actually increased, although the surface area of the palate is increased. Hence why you don't get the big arch, small teeth cosmetic problem when you do segmental Le Fort. In conclusion, we cannot universally say that one should skip MARPE and do jaw surgery or vice versa. It's all individualized. It all depends on where you're starting, what your properties are, and what your goals are. Basically, you have to understand your own case better. If you need help with that, you can do that with me inside of the joint, or you can consult with a healthcare provider who can give you insight as to what your own situation is best served with. Although I will say there is a problem in the field, and I don't think this is restricted to airway dentistry in surgery, where to a hammer everything looks like a nail. MARPE providers think MARPE is the solution to all problems. Jaw surgeons think jaw surgery is the solution to all problems. I think that a big part of what I do is that I provide a bird's eye, 50,000-foot view of the entire field, and I can help patients get perspective on their own situation in a disinterested, impartial way, where it doesn't matter to me whether you do MARPE or jaw surgery. I'm just here to give you the unbiased truth as best as I know it. So if you would like to discuss your situation further and get some individualized perspective, you can do so inside the joint. Link in the description. Hope y'all enjoyed that video, and if I'm missing anything, please let me know in the comments below. Check y'all soon. Peace out.